This video highlights the importance of engaging meaningfully with patients, families and carers to incorporate and respect their goals, wishes and preferences in comprehensive care planning. Heather Moses, partnering with People Lead at the Clinical Excellence Commission, shares the impact and benefits of meaningful engagement, communication and documentation for person-centred care.
Peter, my dad, was 82 years old with end-stage pancreatic cancer and several comorbidities. He had come to the time of transitioning from clinic and home treatment to palliative care. His treating specialists coordinated and discussed a comprehensive care plan with Dad and his wife, my mum Lynn. This was shared with the whole of Dad's healthcare team. Home care nurses initiated and discussed an end-of-life plan with Mum and Dad in their own home. Usually, treating oncologists asked Dad at each step of the way what was most important to him right now. Staff transporting and checking Dad into appointments ensured his comfort, and clinicians checked with Dad that his treatment plan was as he had agreed. As treatment was trialled and things changed, so did Dad's choices about whether to continue or discontinue avenues of treatment. It was imperative that these wishes were acknowledged and communicated with respect and care in medication review discussions. Sometimes Dad felt as though the decisions were being made for him rather than with him. Understandably, Dad was overwhelmed with facing so many decisions. He was often too emotional to communicate his wishes. As a proud man, the overwhelm was confronting, let alone having to face his own end of life. My mum, and often my brother and I, present either on the phone or in the room as part of his healthcare team, allowed us to advocate for Dad. This ensured his wishes were included in coordinated treatment. Importantly, these wishes and updates were usually shared with his whole healthcare team so that Dad didn't have to repeat changes and his reasoning for those time and again. Family involvement in Dad's care promoted staff to include Mum in updates of how Dad was going with hydration and nutrition and his fundamental daily routines such as mobility, toileting, and when Dad was feeling able to communicate for himself and when he couldn't. No 2 days were the same. His energy ebbed and flowed, as did his appetite and ability to digest food. Plans increased to include safe mobilisation to the bathroom. It was a priority for Dad that he continue to feed himself and complete his own bathroom visits for as long as he could manage. And it was important that this current information was shared in handover and intentional rounding. Person-centred care, what matters to me, is a key element in the comprehensive care minimising harm model. Updates and changes to Dad's plan were communicated at multidisciplinary bedside handover, in daily huddles and at transfer of care handover. The inclusion of family was of increased importance when Dad came home for a few days to spend Christmas with his loved ones. We were supported to administer medication effectively, but we also knew which palliative carers, pharmacists and after-hours services would be contactable should we need it. Person-centred care is one of the 6 dimensions of healthcare quality, putting the patient at the centre of the healthcare system. Providing care that is respectful of and open to individual patient preferences, needs and values. Routines that consider patients' needs and support their experience of comfortable, timely and reliable and safe care. Patients are the fundamental part of the healthcare team. Partnering with patients allows for sharing of knowledge and decision making. On a daily basis, compassionate, person-centred care can be as simple as introducing yourself by name, asking the patient's preferred name, and having a conversation about what matters to them most. You can use resources such as the What Matters to You questions. Whilst this seems fairly simple, it's easy in our busy day to assume we understand what the patient needs. The information you learn from your patients, families and carers gives insight into how to provide this unique person with the care they need. Sharing this information in your documentation, such as daily notes, at handover, in comprehensive care and end-of-life plans, is both respectful for the patient but also minimises harm, reduces error and risk, and contributes to safe, quality care. These and other resources are available on the CEC website.